I'm William.
I'm Colin.
I'm Rachel.
I'm Trace.
And I'm Blake, and today we're going to be talking about the Cuban healthcare system. So today we're going to be talking about the funding and access to the Cuban healthcare. Starting off with funding, we have that the healthcare is free to Cuban citizens. This is provided to the citizens through a national health service, and the funding through the service is also by the government. So therefore, the people do not have a lot of out-of-pocket costs, if any at all. Unfortunately, though, the access to healthcare is a quote-unquote wait-in-line treatment. What that means essentially is that they do have to have long hours that they wait for service. And even once they have waited in line, there are a lot of common things such as bandages, bedding, maybe even over-the-counter drugs such as ibuprofen. That is a very hard challenge to get for them, as Dr. Rafael Molina explains later in his interview. In 1961, however, we see how the access to healthcare somewhat changes whenever we have all private healthcare insurances that are phased out, and this is due to the Castro regime, and this correlated to having a primary, secondary, and tertiary care. And on a primary care, we have just ordinary, regular doctors. We have one doctor to look over community and help with basic medical needs. Secondary care gets a little more serious. Here we start to see specialized medical centers for more serious illness. Lastly, we have the tertiary care. Now, this is where we have specialized hospitals to treat things such as unique diseases. This is where we see roughly 5% of patients are treated at this level for various serious illnesses.
Those who go to Cuban medical school must complete a 6-year training program comprised of academic coursework and clinical training with emphasis on primary and preventative care. Non-Spanish speakers must also complete an additional year of training to learn Spanish. After completing the training program, they then must complete a year-long internship in primary care and participate in ongoing professional development for the remainder of their career. The Cuban medical education system is government-funded like their healthcare system, with decentralized medical schools across the country.
The history of Cuba has associations with socialism and revolutionary politics. This attributes to the emphasis on universal health care and public campaigns that are rooted in the values of equality and solidarity. The population of Cuba has a majority of citizens who practice Catholicism and Santeria, which is a syncretic religion that originates from West African and Catholic traditions. These religions can influence treatment options and health-seeking behaviors by causing some individuals to opt for traditional alternative remedies. The traditional Cuban diet can lead to diabetes and other chronic diseases. It consists primarily of high quantities of carbohydrates and sugars, which includes plantains, root crops, stew meats, rice, and black beans.
The Cuban population actually has pretty good health outcomes for being a developing country. They have lower rates of infant mortality and higher life expectancy than other similar countries. The average life expectancy in Cuba is 77.57 years. However, different groups of Cubans experience the healthcare system in different ways. The first group is low socioeconomic status. This can lead to worse perceptions of risk and higher rates of negative health behaviors such as tobacco use, alcohol consumption, poor diet, sedentary lifestyle, and more. Next group is geography. Rural and remote regions have less access to health care, and higher infant mortality and lower life expectancy are expected here than in urban areas. The last group is race. Certain Cuban minority groups have been found to have higher rates of cholesterol, obesity, and heart disease.
For our interviewing process, we interviewed Dr. Rafael Molina. Dr. Molina's father was also a physician. They are from Cuba. His father practiced in Cuba, and here's what he has to say about our interview questions.
How does the technology in Cuban healthcare differ from U.S. healthcare technology?
Well, there isn't very much technology in Cuba for the Cuban people. There is for the rich tourists that come there, but it's not for the Cuban people. The Cuban doctors actually have to rely more on physical examinations and less on imaging, CT scans, MRIs, and that kind of stuff that we do routinely here in the United States.
How do the people of Cuba feel about the Cuban healthcare system?
The Cuban people are not treated fairly. It's like an apartheid against the Cuban people. They have a good Cuban healthcare system, but it's not for the Cubans. It's for rich Latin Americans and rich Europeans that travel there and stay at really nice hospitals, as nice as the United States, with advanced medicine, but they come and they pay in dollars. The average Cuban does not get that kind of healthcare system. When a Cuban gets sick and they go to the hospital, they have to bring their own toilet paper, their own soap, their own light bulbs, their own sheets, because they don't have any in the hospital there. They don't have medicines. They don't even have aspirin sometimes. They barely have antibiotics.